Knock, knock. Hand hygiene. Go ahead and close the curtain for privacy. Hi, my name is Sharon. I'm going to be your nurse today. Can I ask your name and date of birth?
Chester H. 103092.
Thank you, Chester. Today we're going to be doing a head-to-toe assessment, pretty much examining you from the top of your head down to the tip of the toes. Is that okay with you?
That's fine.
Very good, thank you. Chester, do you know where you're at right now?
Doctor's office.
Doctor's office. And do you know what color scrubs I'm wearing today?
Blue.
Blue. What about the day of the week? What day of the week is it?
Tuesday.
Very good. Okay, we're going to start off at the top of the head, looking at the hair. Texture of the hair, very thick. It looks very shiny as well. You can actually see the scalp on this patient. I don't see any dandruff, any flakiness or dryness on the scalp. Face, off a glance, I also don't see any grayness or jaundice to the skin, which is great news. So I'm going to go ahead and go straight to the eyes. Chester, I'm going to have you look at the tip of my finger. I'm going to be shining a bright eye into your left eye. Excuse me. Very good. Okay. Same thing with the opposite eye. Go ahead and look at the finger. Awesome. Okay. So the reason we're using the pen light and checking the eyes this way, we want to confirm that when you shine the light into one eye, that the opposite is constricting and dilating exactly the same. So with the pen light in hand, we're going to move down to the nose, looking inside of the nasal cavity. The patient has a very aligned septum. I don't see a deviated septum at all, no signs of that. There was no drainage, no discharge, runny nose, anything like that. Down to the lips. He has very hydrated lips, no cracking, no dryness on the lips. I don't see any peeling of the skin. Can you show me your teeth, Chester, please? Okay, so his gums are pink. Good sign. We want to see pink gums, tongue, inside of the mouth. Go ahead and open your mouth for me. I'm going to have you stick out your tongue and say, ah, please. Very good. Okay. Pink tongue, back of the throat, there was no redness, no pustules, which is great. A lot of times with those pustules, it's signs of strep or some kind of infection starting. This patient does not display that. So, Chester, I'm going to look into both of your ears next. So we don't have an otoscope, so I'm going to use the pen light one more time. Pulling up and away to look into the ear. Go ahead and turn to the left a bit. Thank you. Awesome. Okay. I'm going to lean across you. If you can turn your head to the right this time. Okay. Looks good. Patient has very little wax, which is very healthy. We don't want to see the ears with no wax at all. Moving down to the chest, we're going to be listening to the heart and lungs. For the purpose of the video, I am going to speed this up, but essentially we need to be listening to each area for 1 full minute. One minute. 1 minute. 1 minute. 1 minute. 1 minute. 1 minute. 1 minute. Very good. With the stethoscope in hand, as far as his lungs, I didn't hear any crackling. Heart, there's no arrhythmia. Very good. We'll move down to the abdomen. We're going to be listening to all 4 quadrants. I'm going to just kneel down really quickly. We're going to start at the right lower quadrant, moving up to the right upper quadrant, over to the left upper quadrant, and down to the left lower quadrant. For 1 minute. 1 minute. 1 minute. 1 minute. 1 minute. Okay, so the patient does have active bowels. We'll do an exam here just to feel if there's any distension. By the looks of it, I don't see any, but we do want to go ahead and palpate right across the stomach. Any discomfort?
No.
Very good. Okay. The stomach is actually soft to the touch. Really good signs. So I'll ask you, do you ever have any trouble using the restroom, passing many bowels by any chance?
No.
No? Okay. When you do go, what color is the stool?
Brown.
Very good. Is it soft? Is it hard? Is it difficult to pass?
Soft.
Soft. It's pretty easy to pass.
Easy to pass.
Awesome. Okay. Is there a really foul smell, or is it just kind of a smell of you know, what you would think that bowel smells like.
Yeah, just a regular
Pretty
smell.
average, very good. Okay, I'm gonna move over to both of your arms, and what I'm gonna be doing is pushing down on your arms. I'm gonna need you to push with your muscles, push up against my arms while I push down, okay? We're gonna start on your right arm. Go ahead and push up against my arm, very good. And just the opposite way, pull down, pull down, pull down, awesome. Let's try the other side. Go ahead and push up, 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 good. And pull down. Okay. So with both of your hands, I'm gonna have you grab my fingers and squeeze them as tight as you can. Squeeze, 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 squeeze. Good job. Okay, so give me the high five real quick. You're gonna push against my hand. Push, 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 push. And now go ahead and pull the fingers towards the nose and eyes. All right, you can relax your arms. So we're gonna move down to the perineal area. Are you comfortable with me doing an exam in this area?
No.
No, okay, so the patient did decline. What we're gonna do is examine the penis and the scrotum. We wanna make sure that we are pulling back on the foreskin, making sure there's no redness, no irritation, no discharge, any odor coming from that area, as well as the scrotum. If we have to go ahead and lift, we're gonna really check in there. We don't want any chafing or rashing, no irritation in that area for the patient. Chester, when you use the restroom and urinate, do you ever feel any discomfort, any pain when you're using the restroom?
No.
No? Okay, can I ask you the color of your urine? Is it very yellow? Maybe it's orange, maybe it's clear. What color is it?
Light yellow.
Light yellow, really good. Okay. Any discharge that you've noticed from your penis?
No.
No? Okay. Is there ever an odor that you've noticed?
No.
Okay, that's good. So we're gonna move down to the legs. And I'm gonna, essentially the same thing we did with the arms, I'm gonna have you push up against my leg. Go ahead and push up. Don't let me push it, don't let me push it. Awesome, let's try the opposite leg. Push up, 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 up. Good job. Just the opposite way, pull down, pull down, pull down. Okay, opposite leg, pull down. Okay. We wanna keep the patient with their privacy, have them have some kind of covering if we do an exam. Anywhere in this area, we're working in this area. The patient does have shorts today, so Chester, I'm just gonna roll your shorts up just a little bit. Right about here. And we want to also make sure throughout the entire exam we're looking at the tone, texture of the skin. It looks like this patient so far, he has very good skin integrity. He's a young patient, so it looks really good. We're going to move down to the feet, and what I'm going to do now is, Chester, I'm going to pull on your toes, on your feet. If you can try and flex your toes up towards the tip of your nose, okay? Don't let me pull them that way. Good job. Now go ahead and push against me. Push, push, push. Awesome. Okay, let's go ahead and look at the toenails themselves. For this patient, actually his toenails look really good. I don't see any ridges. Let's see the side. No blackness, which is awesome. I don't see any yellow toned. We'll look in between the toes as well. Let's try this side. So far I'm not seeing any peeling, any signs of athlete's foot, which is great. We'll look at underneath the toes. Very good. Yeah, his skin integrity is really good. We're also going to examine the heels, the bottom of the foot. We want to make sure that we don't see, so we don't see any, I don't see any peeling. I don't see any cracks on the heels. There's actually no calluses as well. Very impressive, very nice. Okay, very good. Can I have you actually move on to your stomach now if you're comfortable with that?
Yeah, it's fine.
Thank you. So at this point, we're also going to listen to the lungs one more time from this angle. So let's get the stethoscope back on, and again, 1 minute each in each area. For 1 minute. 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 Okay. No abnormalities here as well, fortunately. We're gonna move down to the anus. Chester, are you okay with me doing an exam in this area?
No.
No? Okay. So the patient also did decline the exam on the anus. What I would do in this case, we do want to expose the patient, and we're actually going to get in there. We are going to separate the buttocks. We're going to look in the crack. We don't want any rashing as well. We don't want any redness. We're looking for any pustules, maybe some irritation to the skin. Very foul odor. Some patients, they don't have, because of their weight or other issues, they don't have very good mobility to get to those areas. So we want to just look there. We're also going to look again at the scrotum, because from this angle we have a little bit better view on whether or not there's any issues in that area. So we're going to go ahead and look. Okay, so this patient looks very good. Let's just cover him right back up. And again, I'm going to roll up your shorts just a little bit to look at your skin. Yeah, again, the patient does have very good skin integrity, which is really great. At this point, since we're on the calves, we want to ask the patient, Chester, do you have any pain when I touch on your calves at all?
No.
No. Very good. The reason we ask that, some patients with pain, we do get concerned of possible DVT. So we want to, while we're in that area, just confirm so we can mark that off. Okay, Chester, you can go ahead and lay back on your back if you're more comfortable, please.
Yeah.
Thank you. So I'm actually done with your head to toe assessment. I'm going to just be documenting, you know, what I did today and what we came across with your assessment. So I'm going to go ahead and leave you a call light. It's going to be right here.
Okay.
I'm going to lower your bed just so you're a little closer to the floor. We don't want you falling or anything. If you need me at all, this button here, the green button, just go ahead and press the green button and it'll alert me. I'll come right in and help you with whatever it is that you need, okay?
All right.
Did you need anything before I leave?
No, that's fine.
No? Okay, thank you so much. Go ahead and do hand hygiene. We are done.